The National Health Laboratory Service says it's getting on top of the testing backlog for COVID-19. It's been slashed from around 100,000 3 weeks ago to around 70,000 now. But the lab has told Parliament this afternoon that it's still not reached its target of 30,000 tests per day. Lindsay Dentlinger is following the story for us. She joins us now live via Skype. So why is the NHLS not able to reach that testing target, Lindsay?
Good evening, Shahan. Well, the main reason cited is a shortage of test kits, not only locally in South Africa, but a global shortage. Dr. Chetty from the Health Laboratory Service explaining that the country makes use of certain types of machines to conduct these tests, and therefore they need to use tests specifically made for those machines, and they have to get those tests from the suppliers of those machines. And even though they say they have placed orders well in advance, there's just a global shortage, and they cannot get their hands on enough testing kits to be able to reach that 30,000 test target per day. They're conducting around 15,000 at the moment, but let's take a listen to what she told Parliament's two health committees earlier this afternoon.
There are some companies now that are looking at manufacturing some of the kits. We've got the ability to make those kits ourselves, and we have been doing that, but it's quite time consuming. So that's why it's easier for us to use the ready-made kits.
So how is the laboratory service actually proposing reducing that backlog in future?
Well, Dr. Chetty is very emphatic that the backlog not affect people who are already in hospital and where they need to get an urgent diagnosis as soon as possible. As we know, there is now a priority list as to who will get tested first, and those are the people who are already inpatients, already in hospital. Then, of course, medical staff and high priority patients, those who are known to have perhaps comorbidities and seen as high risk. And that's how the list will filter down. Dr. Chetty is saying that the backlog now is really as a result of community screening, people who have been referred for testing. But for example, she cited here in the Western Cape, it's taking now about a day and a half to get a test result back for a patient that is in hospital. So right now, going according to that priority list is the way they're determining which test they conduct first. And then they're also looking into being able to produce these test kits locally in South Africa. Let's take a listen to Dr. Chetty again.
We've got testing priorities where we prioritize testing for those with the medical need and for clinical diagnosis, then testing for high-risk individuals, testing of critical frontline workers. We've been trying to make sure that we prioritize the in-hospital patients. This is an example from Western Cape. We've looked at the turnaround times for the hospitals in the Western Cape for the inpatients.
Very quickly, Parliament's also hearing from private healthcare groups. What are they saying about their readiness?
Shahan, so we know that these healthcare groups will have to deal with the overflow of patients from the public service. The Department of Health will decide who gets to be treated in these facilities. We've heard from the Life Care Health Group. Netcare is still currently before Parliament. But what we've heard so far is that they're saying it's really difficult to plan. Netcare, for example, has over 600 COVID patients already that they've treated in their hospitals. Life Care also has several hundred, but they are particularly concerned about the Eastern Cape, and so really they are quite concerned as to how they plan, and having to move their healthcare staff to the Eastern Cape and the Western Cape at the moment to be able to treat the patients that they are receiving at this moment in time.
All right, thanks for that. Lindsay Dentlinger is in Cape Town.